Thank you for joining me. Good morning from this side. Thank you for the mic. A very good morning from this side. Thank you for joining in. Wake up show. Wake show. Also. Thank you for the like. Thank you for joining in. How are you today? Please confirm that you can hear me. It's a beautiful morning from this side. Wonderful weekend. This lighting looks so bright. Let me dim this light. I think it's better. I think it's better. I think this is better. Okay. Please confirm that you can hear me. Am I audible? Welcome to this live. Thank you for joining in. Please confirm that you can hear me. Am I audible? Let me know where you're joining from. Kindly drop a comment in the chat. Am I audible? Welcome to this live. Welcome to this live. Welcome to this live. Testing, testing, testing. Loud and clear. Okay, thank you for the feedback. Thank you so much. It's a pleasant morning from this side. Please confirm where you are joining from and what time it is in your location. I always like to ask this so as to know where the audience are mostly and how to relate better. And also considering the timing to see how I can structure my lives and even upload of videos to a time that most people will be able to have access. There are a lot of information everywhere, and many times people get to miss out on some information because of differences in timing, and so it's good to have the feedback so that we can relate better. Thank you for joining in. How are you doing, everyone? Thank you for following. Thank you for the interactions. I have a great community here. Health enthusiasts, people who are committed to their own health and well-being. If you don't take care of yourself, who will? Okay, that's the question. And you have to actually be committed to yourself. And I emphasize that a lot, that you can only give what you have. If you are not uh, a strong person, you are not healthy, how much can you do to help others? Okay, so we need to take care of ourselves. We need to uh, be sure that you are keeping fit. Okay, for example, this weekend for many, and then we have opportunity to exercise physically. If you have not really been doing that uh, in the course of the working week, you have an opportunity to exercise. You have more time this weekend. Of course, I know there are many engagements. People have different schedules, meetings. In fact, some people actually work weekends. Okay, if you are like me, like doctors, and some other professionals may have some duties that require that you are at your workplace uh, for the weekend. Okay, so we're talking about medications today, and it promises to be interesting. It's something that most of us know, something that people do, but I want us to look at different aspects of this. Medications are actually substances that are used to treat, may even be used to actually prevent uh, diseases, medical conditions, as the case may be. Even for those that go through surgeries, they benefit greatly from medication. Okay, I say that because there's a risk of infection when an individual undergoes a surgery. And so the role of medications, for example, to take care of infection, and then also to take care of, deal with pain that the individual may experience during, even after a surgery. So this is very important. Okay. So it applies whether to the medical or even to the surgical aspects of medicine. Okay. So if you are on medications currently, I'm sure you know what it means. It's just any substance. It could be in any form. It could be in form of tablets, capsules, caplets. It could be in form of liquids, syrup, suspension, different forms. In fact, some are actually suppository, where they are inserted via the anus. Okay, so and for gynecology uh, patients, some may require insertion into through their vagina, for example, and that is uh, used in treating some conditions like infections. Okay, so if we're going to be talking about medications, I want you to drop your questions and your comments around this topic. It's a very important topic for every one of us. I say important because people do not just get prescriptions, they do not just get medications from their doctor or pharmacist. There are those that are called over the counter medications, and these are readily available. They do not actually require prescriptions, while the other group are the prescription medications. Okay, if you have ever had a pain, maybe a headache, maybe from stress, or even if you're on this side, Africa, Nigeria, talk about having malaria infestation, then the individual may not just benefit from taking anti-malaria, but will actually benefit from taking analgesics for pain, headache, for example, antipyretic for fever. Okay, so there are those that we call over the counter medications. And if you have ever gone to a pharmacy store to actually get medications yourself, then you got that without a doctor's prescription, then you should be, uh, that means you are practicing over the counter medication use. Okay, while if you get a prescription especially following a diagnosis from your doctor or from a pharmacy, then you are actually uh, working or uh, relating with prescription medications. Okay, so like I said, prescriptions are found um, in different forms, different substances, different constituents, different compositions. Okay, but there are processes through which these medications or drugs actually go go through before they are released for public use. Okay, and when we talk about drugs can be used for prevention, as I said earlier. Thank you. Trying to buy a PC off YouTube. Hey, I have to go to bed, but I hope you do well. Thank you. I've been suffering with a condition called CRPS, and it has been very painful. Please, what's the full meaning of that? CRPS. Could you confirm? And it was very painful, but luckily factors like you made me feel better. Doctors, you mean? Okay, thank you. Trying to buy a PC off YouTube. Thank you for joining me. Thank you for your comments. Well appreciated. Do have a pleasant time. I'm glad that you say you feel better, and that's it. When you take your medications as prescribed, and then you follow with other instructions, then you are sure to get relief many times from whatever condition you are being managed for. All right. So if it's for preventive purposes, of course, that's fine. Even for treatment purposes, uh, an individual has symptoms, then the individual will benefit from taking those medications. So drugs may not just be used by individuals; they may actually be abused. Okay, so there's something we call substance abuse. So these are substances, whether in form of tablets, in terms of in form of syrup, in form of powder, whatever it is, the form, once it is used contrary to its purpose or used uh, in measures that is beyond what is expected, in measures beyond what is expected, then the individual will be said to be abusing such medications. Even if you use your medications beyond the time that is being assigned or prescribed for, then you are abusing the medication. If you also use medication uh, for another reason other than what it was prescribed for, you are actually abusing the medication. Okay, so let's talk about why medications. I mentioned that medication use can be for preventive purposes. Okay, for example, there's something we call malaria prophylaxis, and that is especially on this side, talking about African region, uh, Western region, where we have malaria infestation. The parasite is being transmitted by mosquito, the vector. So there is endemicity, of the uh, malaria condition in every part of Africa, especially talking about Nigeria now. So there are people that benefit from taking medications even without a confirmation of the infestation of the malaria parasite, which is usually done with a blood test, confirmed with a blood test. Okay, but such individuals, in a way, may have worsening symptoms if they don't take medications, if they don't take those preventive medications. For example, I'll give two examples. One, I'll talk about pregnant women. A pregnant woman actually has a risk of certain uh, medical conditions, higher risk, higher risk because there's reduction usually of immunity, and then there's a reduction in blood levels at a point. If such a woman actually gets that infection, the individual may have complications. For example, anemia that can happen in a pregnant woman may not just affect the woman, may affect even the unborn baby. Okay, so if a pregnant woman is going to avoid the symptoms or even the complications of malaria, there is there are recommendations. There's a recommendation for taking anti-malaria prophylaxis. That's what we call it. That's taking even the drugs, medications, without a confirmation of malaria. Okay, so that's very beneficial. Also, in people that have sickle cell anemia, where it may be hemoglobin excess, okay, where the individual has the risk of anemia also, and the risk of complications from getting infected with the malaria parasite. Okay, so such individuals will also benefit from malaria prophylaxis, anti-malaria prophylaxis. So these are reasons why some people may be on medications, not necessarily because they have a medical diagnosis. So it's beneficial. Okay, and there are some other situations where people will benefit. Even for babies, they tend to benefit from some uh, injections, oral medications that can help to prevent certain medical conditions. Okay, so that's that about prophylaxis. Then when it comes to treatment, most of the time there's something we call empirical treatment. That's talking about treating a medical condition from a clinical diagnosis perspective while awaiting confirmation of the condition with a lab result. For example, if somebody has a urinary tract infection, which may come with symptoms like frequency of urine, dysuria, painful urination, nocturia, urinating more often at night, these are some symptoms. And fever is also possible in an individual with urinary tract infection. So when such individual uh, as these symptoms present to their doctor and with history, proper history is being taken, the individual being examined, and from all differential diagnosis, that's what we call them, differential diagnosis, the individual is found to actually have this diagnosis of urinary tract infection as top on the list. So such an individual may benefit from empirical treatment. So medications may also be given to the individual before a confirmation of the infection. And when, for example, analysis is done, they show some nitrites, so show some protein. Some people may even show blood in the urine. While a microscopic culture and sensitivity will help to identify a bacteria, may even be a fungal infection in the urine. So this will help to guide in the use of medications, especially antibiotics. So there's something called antibiotic misuse, antibiotic abuse. So we, as medical professionals, there are actually regulations for use of medications to prevent uh, these abuses and misuse of medications. Okay, there's something we call antibiotic stewardship, where we look at proper prescriptions, giving patients appropriate medications and not giving room for abuse of these medications. Okay, so if an individual now has a diagnosis, they benefit more definitely from taking appropriate medications. Okay, so one of the things that you need to know that you as a patient or a client, you are appearing before your doctor, whether physical or on virtual interaction, you should be able to ask questions relating to prescriptions. For example, if you have a certain prescription given to you, you should be able to ask doctor, and if you are not aware, you don't know what this is, you should be able to ask what the medication is for. And I have this interaction a lot, and I appreciate patients who ask questions relating to medications that they are being given. Okay, so this helps to bridge the gap between me as a doctor, myself, in communication with my patient. So a lot of gaps may exist between doctors and patients because there's a challenge in communication. So it is very important that that you are free to relate with your doctor or physician as as expected. You should be free to express yourself in terms of your complaints, in terms of the other information that even your doctor may not have asked. You should be free to ask. Welcome, Patrick. Thank you, Mr. Patrick, for joining in. Welcome to this live. Thank you. Thank you for the live. Thank you for the votes. Glad to have you here. Okay, so we are talking medications. I was talking about the place of asking questions. Very important to ask questions from your physician about medications that you are being given. And if you are not clear, even when you get to the pharmacy or when you are being given the medications, you should also be able to seek clarification. Now, this is important because some people have actually received medications clearly outside of what was prescribed. And then this could happen, error could happen in between um, writings or typings, and there's so many gaps that could cause this. Okay, but that is why you as an individual should be sure that you are asking questions, and you shouldn't feel bad that you are asking those questions. I'm sure that if you have the right physician, you have the right medical team, they will surely give you appropriate responses to your questions, and clarifications to be made. So you should ask questions. Okay, what is this drug for? What is this medication for? How am I supposed to take this? And so, with that understanding, with that clarification, you'll be sure that you are not abusing the medications, or you are not taking in something that you should not be taking in as an individual. Okay, so there are people that have actually suffered from some complications from using medication, inappropriate medication. Okay, that can happen. Of course, there are situations where there are definitely different brands, but the same composition. So in such a situation, individual will still benefit from that, but uh, there is some little differences because of uh, the uh, brand peculiarities. Okay, so that's very important. And when it comes to medications, you need to know that you need to follow your doctor's prescription. When I say prescriptions, your doctor says use uh, 2 tablets of so medicine, then you should follow that. But if you have any complaint relating to that, you probably do not feel you are getting uh, relief of your symptoms, then you may need to consult with your doctor and seek for a review of your medications rather than choosing to go lower or even higher than a doctor has prescribed, especially if you trust the judgment of your doctor. Okay, but if you have questions, you can always consult with another uh, health healthcare provider so that you can be sure that you are receiving the appropriate uh, prescription and medications. Let me know where you are joining from. Let me know where you are joining from. Let me know where you are joining from. We still here, Mr. Patrick. What show author. Thank you for joining in. So you can drop your question in the chat. You can drop your questions in the chat. Hey, Mama Chidima, Evelyn, welcome. Welcome, Evelyn. Welcome. Thank you for joining in. Now, on this side, you can see how to use the backup now. All right, so we're talking medications. Let me know what you think about use of medications. Have any question regarding medication? Okay, so I believe you can just see me. Thank you for the votes. Thank you for the likes. I believe you can see here. Good morning, Evelyn. Welcome to this live. Welcome. Okay, so we are talking about medications. So I was emphasizing the importance of keeping to the prescription in terms of the dosage, the number of tablets, or even the volume of liquid that has been prescribed for you as an individual. You may even be someone that is offering care, a caregiver to another. Then these are very important points for you. Then the number of days, no, the number of times, first of all, in a day that the drug is expected to be taken, and then the number of days. So going beyond this sometimes may be called abuse of that medication. For example, there are people that even use antibiotics without prescription, and this can lead to resistance. And resistance, where in the case where we talk about uh, bacteria now becoming more virulent, now not being tolerant to the antibiotic because the individual are chosen to use the drug below the level that is expected to deal with the bacteria. Okay, so you need to understand that these are very important uh, aspects when it comes to use of medications. So some people find out that they are not able to get certain responses or relief from using certain medications. And it may actually be because you or some other person had abused these medications or drugs, and then the bacteria is now extra strong. Let me use that term to deal with the medication. So the medication is no longer affecting uh, the 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 bacteria. So that's resistance in a way. So if we are going to be dealing with resistance, we're going to be having medications doing their job as they should. Then we, as individuals, have roles to play. Talking about the medical professionals prescribing, and then the patients receiving needs to prescribe appropriately in terms of the appropriate medication in appropriate dosages, and then for patients they need to use medications appropriately. So some people even go to the extent of getting some prescription medications as over the counter medications, and this is very dangerous, okay, because there is usually a reason why your doctor will prescribe medication. There is usually a reason, there's an indication. So taking a medication that is not prescribed and is supposed to be prescribed may be dangerous, okay, it may be dangerous. There are other things I want to talk about when it comes to medications. Let's talk about side effects. The important thing I want to emphasize here is that all drugs have side effects. Some people go to Google and then they start checking out names of medications that have been prescribed, and then they found out that, oh, there's a long list. There's a long list of. Please confirm that you can still hear me. I want to be sure my audio is clear. Hello, 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 Marshall. Welcome, Marshall. Thank you for joining in. Please confirm that you can hear me. Thank you for voting. Remember to double tap on your screen. Thank you, thank you, thank you. Marshall, we are talking about medication, medication use, what you need to know. All right. So I was talking about the need to understand uh, that if you also use medications that are prescription medications, you take them as over the counter. This may happen different ways between, of course, the agreement between um, patients requesting from the pharmacy store, and this may actually lead to some unpleasant results. Some people may benefit, some others may encounter the many side effects and even complications or in using medications. By the way, I need to mention that when it comes to medication use, there's something we call drug history. That's talking about certain medications that an individual has been taking prior to or even while still seeing their physician. Okay, and there is something we call drug allergies, reaction to drugs. Some people react to penicillin, some people react to sulfonamides, and these are very important in prescription drugs or even over the counter medications. So, when you give your doctor appropriate information about your reaction to medications, this helps your doctor to avoid giving you such medications, I mean, even similar medications that could trigger such side effects or even complications. Okay, that's very important. Okay, so I was talking about people taking prescription medications as over-the-counter medications. Okay, that can happen. Okay, and it's not actually acceptable. Okay, over-the-counter medications should be over-the-counter medications. And after using even over-the-counter medications for some time, and you seem not to have any improvement, then you should consult with your doctor again. Uh, it means there's still a need to get some checkups and appropriate treatment. Okay. It may even mean it may mean doing some further investigations to identify the condition appropriately and receive appropriate treatment. Okay, there's something we also call drug interaction. Now that has to do with the fact that there are certain drugs that should not be used with another or with others, as this may lead to some unpleasant uh, results or experiences for the individual. Okay, and then there are some, hello, and there are some that are going to worsen uh, the condition from using those two medications about at the same time, or even reduce the effectiveness of one of the medications. Efficacy of the medication may be reduced because you are using it with another. Okay, so your doctor will be able to identify this and ensure that such medications are not prescribed together. So that's why over-the-counter medications are actually different from prescription medications because there are a lot of information around medications. As I was talking about side effects earlier, um, there are many side effects to medications, many, and that should not be a reason to not take your medications. Okay, the only reason why you may stop your medication is if you have some unpleasant symptoms, unbearable, or even, of course, if you have a reaction that will require you presenting to the hospital, you may need to just stop that medication at that point in time. Okay, so if you have some very unpleasant feelings when you are just commenced on a particular drug, then you should note that you may need to stop that medication. Some may be mild feelings, mild symptoms, mild side effects that over time your body will get over. All right. And apart from drug-drug interaction, there may also be drug-food interaction. There are certain medications that may interact with your food that, um, with guidance, there are some medications that should be taken with food. There are certain medications that should not be taken with food. For example, we have some non-steroidal anti-inflammatory drugs. There are those that are called non-steroidal anti-inflammatory drugs that require um, food before taking them because they can actually erode the lining of the intestine and lead to ulceration. And this is not a pleasant thing at all. And there are certain medications that do not require food. For example, I hear a number of people say they've not taken their medications because they are not eating. Talking about antihypertensive, now, if you are a known hypertensive and you have medications that you are taking, for no reason should you say because you're not eating, because antihypertensives mostly do not need food before their action. Like I tell my patients, stroke will not wait for food before it happens. Whether a person eats or does not eat does not determine whether they have a stroke or not. It could be actually from elevation, uncontrolled blood pressure. Okay, so this is a very important point that you should note. And there are others that mostly you should take your medications with water. Okay, there are some that you may say, oh, you may use with some milk and all, but mostly water is good to take with medications, especially tablets, capsules, and all. And you should note for emphasis that you should follow the dosage, the volume, because this um, is very important as some people overdose on medications, and this overdosing may lead to unpleasant experiences, may lead to organ damage. For example, the liver, paracetamol, as simple as it is, or as it is an over-the-counter medication, Tylenol and all, they can cause damage to the liver if used uh, more than the required dosage for a day. Okay, they can be toxic to the liver and other organs. Some medications can affect the kidneys, and this can lead to acute kidney injury. So these are important points, things that you need to know when it comes to use of medications. I've talked about drug-drug interaction. I'll talk about drug-food interaction. Okay, so when you find out that you get some unpleasant experiences, side effects around eating and taking a particular medication, then you may need to consult with your doctor for proper review of those medications. Okay, let me know if you are still following and if you have a question, you can drop in the chat. I'll be glad to take your question. Okay, we're still talking about medications. Some medications actually require that you do a test uh, before or uh, after taking medications. Okay, for example, your doctor may ask if you are diabetic to take a measurement, get a value of your blood sugar done the morning fasting before food and then before you take your medications. Some other situations may require after food, maybe an hour or two after food intake, then you can take your medications. So you should take note of these different. So that's why it's important. Take note of these different peculiarities around medications. That's why it's important to pay close attention to your doctor's communication with you, prescriptions, so that you can get the best out of taking medications. Of course, medications are beneficial in as much as they have side effects, but they are beneficial. So once the benefits outweighs the risk of using a certain medication, even if it is for a pregnant woman, uh, it is still allowed to be used rather than not taking medications. Many people here today have actually taken medications for relief from pain, from fever, and all, and this have been very helpful. So there are some myths on I wanted to say hypertension. There are some myths on medication use uh, that I just talk about before we end this live. Now, one is that some people say, "Oh, when you're on medications, you'll be on medications for life." Not not all medications are taken for life. Okay, there are certain chronic medical conditions definitely that require taking medications for as long as your doctor sees that you need them. But many medications, some acute medical conditions actually require medications for shorter periods, um, different from chronic medical conditions. Okay. Uh, Another myth is that somebody says I can take this medication because I have the same condition that another, maybe a friend or a family has. Now, this is wrong because the fact is that before a prescription was given, there were processes, including history taking, examination, possible investigation to determine if this person had a particular diagnosis and then the proper medications given. So sharing medications is not appropriate. Interestingly, people body composition differ and people react to medication in different ways. So someone taking, for example, antihypertensives are, are different classes, performing different functions. You know, there are certain considerations that your doctor will put in before prescribing, even if it's an antihypertensive or even oral hypoglycemic agent. So you need to note this. You cannot just take another person's medication, and this happens a lot. People doing doing home consultations where people are becoming untrained professionals in quotes doing the work of the professional now. So we need to be careful about that. Another myth is that, oh, when I'm attending the clinic, I should not take my medications that morning before getting to see my doctor. No, no, no. That is not correct. Your doctor will prefer that you use your medication as prescribed, even when you are coming to for a follow up, because you should still have your medical condition controlled. For example, your blood pressure. I hear a number of patients sometimes say, oh, because they were coming to see the doctor, they thought they should hold on their medication. And that is not true. It is not correct. You should still use your medication, even when you are seeing your doctor on same day, except you have certain complaints or side effects or a complication from that use of that medication. Okay, that's very important. Any other myth on medications? Myth on medications. So, what questions do you have? What questions do you have? Another myth I can remember is that, oh, some medications don't have side effects. No, the fact is that all medications have side effects. They only differ in the numbers and differ in the level of effect that they have on the individual. So that's very important to note. Okay, some are bearable and some are unbearable. Okay, that's very important. Okay, I need to also emphasize the fact that there are some medications that are contraindicated in some certain medical conditions. Okay, for example, we do not use some certain antihypertensives in patients that are diabetic. Okay, and you need to note that there are certain medications that we don't use and give to people, individuals that have sickle cell anemia. Okay, there are certain medications that are not beneficial for a pregnant woman and a baby. Okay, so these are other areas to consider. All right, so you should take your medications. If you have a prescription, I want to encourage you. Of course, there is something we call polypharmacy, people using many drugs. So when you have many medications that you are taking, you may, if you feel concerned that you want a review, then you should talk to your doctor so that if there's a need to actually stop some medications, then your doctor can say so. And if there's a need to reduce dosages, then your doctor can do appropriately. Okay, so you should take your medications as prescribed um, in terms of dosage, in terms of numbers, in terms of number of days, and how often. All right, so I believe I've given some important information on medications, with some of the things that you need to know to get the benefits from taking medications. So medications are very useful. They are good, and they serve the purposes for which they have been made. Okay, but they could be abused. So using avoid using medications where they are supposed to be prescribed, and then avoid using less than the number of days prescribed or even more than the number of days prescribed, except you have a review of those medications by your doctor. Let me know if you have a question in the chat. Be glad to take your question. Welcome, everyone. Just joining in. We'll be talking about medications, medications. Have you ever had any experience with use of medications? Maybe some side effects, maybe some reaction. Just be free to share your experience with us in the chat. Thank you. Uh, just joining in, you can actually watch from the beginning. After I end this live, to be available on the channel so that you can get the tips that I've shared on this live. Thank you everyone for joining me. Bye for now.